Good morning, everyone. It's Dr. Hodges. I still can't find my stupid little walking stick thingy. But I do have a new phone, and so I'm wondering if the quality of this video will look better. I have the new Samsung phone. I always say, I'm not going to the dark side. I'm not getting an iPhone. So anyway, I digress. What I wanted to talk a little bit about today was the ugly of bariatric surgery. You know, so often, whenever you look online, everybody's talking about all the good uplifting, which we want, of their weight loss stories, their weight loss success. But you know, there's always going to be some cons to any pro. I mean, that's just how life works. So there's always going to be the yin to the yang. And so let's talk a little bit today about what happens if you've had weight loss surgery and now something feels off. What are these things that can be off, and what can you do about them? And the majority of the time, issues that patients are having, they're going to be nutritional. So let's talk about the most common ones, as well as just some common post-operative complications that can arise, and the best way for them to be treated. So let's get started. So talking about some nutritional things. If you are a patient and you are experiencing fatigue, like a profound fatigue, or just like you just feel tired all the time. I have some people and they'll come in and they're like, I just feel like I just need to take a nap every day. So if you're fatigued, if you're having hair loss, the first two things that I'm going to think about are anemia and low protein. And so, especially if you're a lady that has a heavy cycle or a prolonged cycle, or let's say you just have a cycle more often than not. So maybe I'll have some patients that they'll tell me, oh yeah, my cycle might last 2 weeks. Yeah, well, that's not normal. That can contribute to an anemia. And so if you're feeling very fatigued, or if you are having hair loss, the two main culprits are going to be low protein and or low iron. And certainly low protein can also contribute to an anemia because the body needs protein to carry the iron. Okay, and so typically the first thing that I recommend that patients do is you're going to need to get some lab work drawn. And then you also will need to make sure that you're increasing over and above what you're already doing. So in terms of iron and protein supplementation. So for instance, if your patient comes into my office, I'm going to get a quick set of labs. Let's say they're doing a good all-in-one vitamin. So really good all-in-one vitamin is Ultra Solo, Bariatric Advantage Ultra Solo with iron. And I'll have a little link to that in the comments below. Really good. You need 45 milligrams of iron. But you know what? Maybe that just doesn't cut it for your little body. Maybe you just don't absorb iron as readily. And certainly if you've had a good morning, if you've had gastric bypass or duodenal switch, you're going to be bypassing the duodenum. That's the first portion of the small bowel. And you're just going to be a little bit more at risk for not readily absorbing iron, because that's where most iron is absorbed. And that's the part that's being bypassed. And so if you're already doing a bariatric iron, I would just go ahead and double that iron that you're already doing. So usually I will give you a prescription for iron. What you could also do is Bariatric Advantage also has an additional supplemental iron that's 45 milligrams. I will also say online, and I'll have a link to this as well, I know on Amazon, I know that you can get, I think it's by Mega Foods, but it's called Blood Builder. And I would double that dose. What I like about that one is patients are at a little less risk for developing constipation, because you can certainly develop constipation if you are taking extra iron. Now, if your iron is really, really low, you may just end up needing a iron transfusion, but that you won't know that until you get your iron studies back from your lab work. So first thing I would do is, number one, make sure you're taking your vitamins like you should. So if you're not even doing that, you have to do your bariatric vitamins. Number two, if you're already doing your bariatric vitamins, you need to go over and above what you're already doing. When it comes to protein, if you have a sleeve or bypass, you need to be doing 60 to 80 grams of protein supplement. That means in addition to the food that you're already eating. If you're having a duodenal switch or you had a distal bypass or revision of an old bypass, then you need to be doing 100 to 120 grams of protein a day. If you're not doing that, you have to meet that goal, and then you might need to add in an extra 20, 30 grams on top of that. And so that would be my first thing, is if you're first thing that you can start doing before you ever even go see your bariatric surgeon for follow-up is make sure that you're taking your vitamins, make sure you're doing your protein. If you're not, you have to meet those goals. And let's say you are, you need to go over and above, okay? So second thing that patients can happen, if you're having swelling, a lot of swelling after surgery, and sometimes this can happen not initially, sometimes this is something that will happen usually like 6 months later or a year later, or let's say you had surgery and it's 2 years later, and now you kind of do the things you need to do, or maybe not, usually not, and now it's 2 years out and you're having bilateral lower extremity swelling. The very first thing that I'm going to ask you is how much protein do you do? Certainly your doctor needs to be, aren't those flowers pretty? One of the things that your primary care doctor is probably going to be concerned about is, what is your heart? How's your heart doing? Because bilateral lower extremity swelling, so swelling in both of your lower legs, can be very concerning for heart failure. And so that might be something that they want to look at. But if you've had weight loss surgery, the other thing that I'm going to be concerned about is where's your protein level and where's your albumin level. Because if those are off, you hands down will have issues with swelling. And so every person needs 1 gram of protein per kilogram of body weight. And so the first thing that I would do is take your weight and then divide that by 2.2. That will tell you how many kilograms you weigh, and that will tell you how much protein you need to be getting in on any given day. So you could just roughly take whatever your weight is and cut it in half, and that's a good ballpark of where your weight is in kilograms. And so let's say you weigh 200 pounds, your body needs 100 grams of protein. If you find that maybe you're a couple of years out, now you're having all this lower extremity swelling, the first thing that I would probably do is, if you're not doing any protein supplement, then you need to make sure that you're doing 60 to 80 grams of protein supplement a day. That means in addition to the food that you're eating. Let's say you had a duodenal switch and you used to do your 2 protein drinks, 2 or 4 a day, and now you've gone down to 1. You definitely need to make sure that you're getting back in to doing like at least 3 to 4 protein supplements a day. So a lot of times what I hear is patients will come in and they've done really well that first year, and now I'm seeing them 2 years out, 3 years out, 4 years out, and they had a DS, and now they're starting to experience a little fatigue, they're experiencing swelling. They might say, well, I've always kind of had bad veins, so I've always been a little bit more prone to swelling, but now the swelling is really bad. The very first thing I'm going to do is look and see how much you weigh in kilograms. So take your weight, divide it by 2, officially 2.2, but you can just cut it in half, and then that's how much protein you need for the day. Let's say you're already doing 100 grams a day. Then that means that for your little body, you need to have more. So you need to bump it up by at least another 30, maybe 40 grams. I have a lady right now that she had a bypass, and she has been doing 60 to 90 grams in supplement every day. But she's starting to have some issues with swelling, with some nausea. And so the first thing I'm doing is getting her, and her protein levels, when we looked at them, they're on the very, very low end of normal. She needs an additional 30-40 grams. That's the first place that we're going to start. The other thing that, good morning. The other thing that I'll also look at is, let's say somebody presents and they're having issues and they're like, my taste is off. What's going on with that? Or I just don't have a taste for these things. Now, I will tell you, after surgery, it's not uncommon for patients to end up telling me that they just no longer have a taste for a lot of the different foods that they really liked before. And now they actually really enjoy other things. That actually is normal. What I'm talking about is if some people might almost have like a little bit of food fear, or so they're afraid to try anything, or maybe they're having issues where it doesn't matter what they eat, just everything just tastes off. 9 times out of 10, that's going to be you're not doing your multivitamin regularly, so you're not getting in some of the micronutrients like zinc and copper, but then also, or maybe some of the B vitamins, which is why it's really important you get a good bariatric multivitamin, so you're getting in all those micronutrients. Or the other thing is that you're just behind on your protein. Are we seeing a familiar theme here? It's just that your body uses amino acids in almost every process that your body does on a regular basis. So also, if patients have really dry skin, or if they're if they get a rash, I had one gentleman, he came in and his hands were kind of really red, and it's almost like he had a rash, but they were dry and peely. That was actually an iron deficiency. He was really iron deficient. Or if you notice some changes in your nails, like spoon-shaped nails, that can also be an iron deficiency. Let me see, what else? If you're having hair loss, that's either going to be iron deficiency, low protein. The other thing that I think will be really important is that you also increase your zinc as well. I'm going to make a post of the specific micronutrients that your body needs as a bariatric patient. And that means you're always going to need them. So what I would recommend that you do is get your whatever multivitamin is that you're taking, make sure that what you're taking matches up with that. And if not, you either need to get a different multivitamin or you got to start adding in. And I'll tell you, I had one young girl, she came in to see me and she was like, I only want to do a liquid vitamin. And I'm like, okay, let's see what we can do. Because I know a lot of times if you go to the different health food stores, they'll have tinctures and liquids that you can take. But I mean, so I think she ended up doing like Centrum Adult and a liquid, but she was taking 4 or 5 other liquid vitamins in addition to also doing like B12 under her tongue. And so, I mean, sometimes it can just end up getting more complicated and frankly a little bit more expensive if you have to start piecemealing some of these different vitamins together. But it's important that you know that you have to do these vitamins on a regular basis, okay? And let's do the final one. Oh, if you get any numbness or tingling in your hands or in your feet, or you get weakness in your hands or your feet, that can be, or lack of concentration, that can be a lack of your B vitamins. So you need your B12 and your B1. Those are huge. Ages ago, early on in my career, I had a young patient and she was a hairdresser. And she took all of her other vitamins and she just didn't do with the B12. She didn't like to stick it under her tongue. And she didn't want to give herself a shot. And she literally cut hair for a living and would not do her B12. And I remember I had her in the hospital because she had a really bad neuropathy like in her hands. And so we were trying to do a workup. She had a couple other things going on, but the biggest thing was that she had a profound B12 deficiency. And a little side note on that, You can either do B12 sublingual under your tongue, 1,000 micrograms a day. You can do like 5,000 like in the nasal spray, or 1,000 in an injection once a month. It's all the same bioavailability. If you do a B complex that you swallow, your body's only going to absorb 1% of the B12 that's in that vitamin. And so that's why you need to do a B12 under the tongue, because it's going to get absorbed directly into the bloodstream. If it ends up having to kind of go through your digestive tract, you know, and go through the gut, i.e. you have a pill that you're swallowing down, you're just not going to be absorbing that much of it. And so that's why we want you to do a B12 under the tongue. If you're seeing any changes in your vision, you want to take some extra vitamin A. So I think that's a pretty good little quick roundup of, I just kind of feel off. What's going on? And like I said, usually they're going to be nutritional. So I'll give you some links and some information to go to, and do your vitamins. Hope that this helped.